like if you decide to do surgery and you go and lie in a surgical bed and the surgeon starts, of course they will put anesthesia on, but let's assume they do anesthesia. You cannot get up in the middle of the surgery and say, I won't do it again.
Yeah.
No, you can't do that. Always the best to start with the conservative approach. I mean, it's safe for other patients, for example, who have had decompressive surgeries done and the original problem was solved. But by the time they finished, maybe a certain leg was tight or something like that, and now they are paralyzed. I always say that our approach is more like the long term, but sometimes it's safer. Maybe because you're feeling good small, it's how it again. I get it. So you need to travel the whole length and make sure that you are finished. The physio has discharged you, you sorted everything out. I get it. Because it's a process sometimes. Like I said, you will feel better maybe after taking the first or two sessions. But then you have to go through the whole process and make sure that you are really better.
So welcome back once again. I know that the conversation in the previous episode was so interesting. We couldn't cut it short for you because we had so much more to give you. So welcome to the second part of our low back pain conversation. And this episode is proudly sponsored by Starbalm, your go-to brand for all your pain relief needs. That is a very interesting phenomenon. But I'm very much interested in what happens to the bones at your back that result in most of these low back pain that people complain about. So let's say when you were talking about the posture and then the discs, become thinning and then the spaces also reducing in size. Is that something physiotherapy can do concerning these discs, these bones, these spaces?
Yeah, great question. So let me start by saying that usually when we have, low back pain can be categorized as a musculoskeletal disorder. A musculoskeletal disorder. So as in your muscles and your bones. Anytime there are musculoskeletal disorder, you can even stretch it to have neuromusculoskeletal because the nerves are mostly involved. Yes. There are two main options.
Okay.
It's either we are doing a surgical intervention or what we call a conservative approach.
Okay.
Yes. Surgical intervention, so there's a problem in there, pressure on a certain nerve, giving you symptoms down there or something. So the surgeon said, I need to go in, cut you, do a decompression, put some stuff in there, sew you up, and you are good to go. Of course, after that one, you still need to go through, physio rehab because once a knife has touched the body, things are not the same again, and that's where physios come in. Yeah. Now, so that's one option. The other option is a conservative approach. Let me say that even the surgical approach, it's not as though anytime there's a problem with your back, even the surgeons will just give you surgery as the first option. And the surgery is supposed to be the last option. You understand? So it's not like the surgeons are just there waiting for us to cut somebody up. Yeah. Now, the conservative approach, where we fall as physios, is we saying that, listen, this has traveled a certain year. Your body has not been able to do some things over a period or has been doing it the wrong way. Let's redo it. Let's do it again. We teach it, re-educate it. I get it. So our approach, I always say that our approach is more like the long term, but sometimes the safer approach compared to the surgery. I mean, surgery, short term, when you decide to do surgery, you go and lie down. If it's even 8 or 10 hours, after that one, we are done.
Yeah.
I get it. So it's a short term, but sometimes it can have a few effects. And the few effects may not have anything to do with, let's say, the surgeon's competence or something. Sometimes, I've had patients, for example, who have had decompressive surgeries done, and the original problem was solved. But by the time they finished, maybe a certain leg was tight or something like that, and now they are paralyzed. It's an accident that happened. Sometimes it can oriented, but sometimes we don't know. I get it.
Think
Exactly. So we are saying that it's always best to start with the conservative approach. I mean, it's safer. It takes a while. But what people need to understand is that it is not you deciding to do the conservative approach is an option that you have taken, and you need to stick to it. Are you getting me? Just like if you decide to do surgery and you go and lie on a surgical bed and the surgeon starts, of course, they will put anesthesia on, but let's assume they do anesthesia. You cannot get up in the middle of the surgery and say, I won't do it again.
Yeah.
No, you can't do that. Are you getting it? So why is it that when it comes to the conservative approach, in the middle, because you're feeling good small, it's I won't do it again. Are you getting it? So you need to travel the whole length and make sure that you are finished. Your physio are discharged, you sorted everything out. I get it? Because it's a process sometimes. Like I said, you will feel better maybe after taking the first or two sessions, but then you have to go through the whole process and make sure that you are really better. And so what we are doing, like I said, answering coming back to your question, what exactly do we do? As for the bones, a bone is either broken or it's not broken. Usually people like to call physios as a bone specialist, and I think that is not entirely a good description of us. I think orthopedic surgeons are more bone specialists. If the bone is broken, they go there and chisel and and sort it out. So they are bone specialists, or maybe osteopath or something like that. We do a lot with the soft tissues that are supporting the bones. The bone, like I said, is either broken or it's not, or it could be degenerated, a bit of arthritis here and there, but we can't really do much about it. I get it. But then the soft tissues that are holding the bone, supporting actually the bones, a lot can be done about it. It doesn't even matter the age that you are. We can do something about it no matter what has happened. So I like to consider myself as a soft tissue expert rather than a bone expert. I get it. Yes. Because it's either torn. If it's torn, unfortunately it's not a full tear and it's a muscle. The good thing about the body is it can repair itself. Are you getting me? Unlike bones even can repair, bones will heal. But the reason why a surgeon needs to come in is because we need to put the two broken edges together or sides together. So that's where the surgeon goes in and does and puts plates and metals, and nails to make sure it's there. But if you have a soft tissue that is not entirely torn, a little tear, all we need to do is to work the soft tissue, because once there is good muscle activity, there's a good demand for blood. Once there's good blood, there's good oxygenation, good nutrition. And these are the things that the body needs to heal itself. Are you getting it? So then you realize that the body is taking care of itself. And that is why your physio, even though you may be in a certain pain, is still asking you to do a certain exercise. It's because the concept is that we want to increase blood circulation. That is different from all the strengthening and other stuff that we do. But then we are increasing blood circulation to aid the body to heal itself. Exactly. Yeah.
Okay. So, usually, typically in our setting, people go to the GP before they come to physio with most of their conditions. Because I feel like people still don't know that you can just walk into the physiotherapy department and have your complaint. So concerning low back pain, most of the time we have people going through various treatments, getting various drugs and all that. And then when it does not work, then the GP will refer them for physio. Do you think this then affects the outcome of your treatment, or maybe your prognosis on how better or faster they would have recovered if they came straight to physio? And do you think these things have anything to do with how you treat them and how they respond to treatment?
Yeah. So when it comes to this issue about, I get asked most of the time, do you need to see a GP first before seeing a physio? Can you just walk in? I mean, in some jurisdictions, it's a matter of legislation. So some countries are very clear about it. You need to, for example, see a GP before you see a physio. In Ghana, interesting, a lot of things are a bit laxed. So in terms of legislation, there's really nothing there like that, But there's a way that the whole, shall I say, healthcare system is set up. The whole hospital setup is, and it's supposed to make everybody comfortable. I get it. So yes, I have seen patients who have just walked in. I mean, a lot of the patients I see, they just walk to my clinic, and I see them and we get good results. But because I mean, when you're in a typical hospital, there's this multidisciplinary team approach, and this is how it works. So somebody has pain. I have back pain. I go to see my physician, my GP, and he does his assessment, and he realizes that you are in so much pain. He's going to give you some medication, pain relievers to bring the pain down, and he's supposed to refer you for physiotherapy. So it's a system. The reason why sometimes it is good, or most times it's good to do it that way, is that sometimes your pain is so much that you cannot even do the things you're supposed to do. Sometimes even doing an assessment to find out where we are starting from, it becomes a problem. So if the patient has taken a certain medication, it just gives a certain platform. Are you getting me? The other thing too is that it's not, like I said, low back pain has got a plethora of causes, so there could be other causes, that may also be medical systemic cause of low back pain. So it's just safer. At the end of the day, it's not really a competition between doctors and physios no. At the end of the day, the patient has to get better.
Yeah.
We want is the patient interest. The patient's interest is what we are looking for. So if we have to combine our forces like we used to do, we used to watch in Captain Planet about combine. We just want you to get better.
Yeah.
And there are jurisdictions that will do it so nicely, seamlessly that at the end of the day, the patient benefits.
Yeah.
I get it. So we just when you go to the system like that, patient going to a GP or an orthopedic specialist, before a physio, I don't see it as a problem. I mean, for example, when you come to one of the facilities I work, you are supposed to see a GP first before you see a specialist, an orthopedic specialist or a neurosurgeon and stuff like that. Because it just helps the system take away something. By the time it's getting to this level, we know that we are so sure this is what it is, and you need to do that. And I think the same system that we work here, with. So we have done assessment. We realize that this cause of low back pain is really musculoskeletal MSK. So go to the physio, let them sort you out. It's just that now is the problem is expanded. Now it's not just the whole hospital stuff. Now we have all kinds of alternative people doing all kinds of stuff. So people are going through all kinds of people. I don't want to, step on any toes. Going to pass here, this one small. A lot of things. I've some years back I've sat in, public transport, maybe going to. The long journey ones, maybe Kumasi or something like that from Accra, it's a very long journey. So when these people get into those buses, and the amazing thing is a certain word called Amamai. They said that Amamai Negu Sisi, and Amma will pay enough. I don't think I understand how that thing started, the genesis of that Amamai syndrome.
Maybe they can explain better if you give me opportunity.
Yes, so people, it just do the normal hospital thing. I just want to plead people. People ask me all kinds of questions, should you go here, should you go? You just go to the hospital with the physiotherapy center, and go to the system. But that not said, I mean, like I said, I see a lot of people who have just come, for physio, and we have managed them, and it's great. So I think that both.
Okay. Yeah. All right. So talking about these, other ways that people go before they go to what they are typically supposed to go to. Let's talk about self-management. Most of the time people have any pain, they grab some ointment, they massage their place, and it feels good for maybe a few hours or sometimes even a day, and then it comes back again. What do you think about people self-treating when it comes to low back pain? Does it have adverse effects on them sometimes, and does it also help you in any way? Okay,
so I mean, self-management I think is something that we cannot take out. Actually, it's something that we encourage. Remember when I was talking about what we do as physios and the management stuff, I was talking about how there is always a home program. There is always something you have to do at home. It's just best that even your home treatment is organized, is prescribed. Just so that you don't just go and do a lot of trial and errors until you mess it up. I get it. Yes. So I would advise that. I mean, and in terms of self-management, I would say that people should try and exercise. General exercises is a major preventive thing when it comes to low back pain prevention. Going for your usual walk. Trying to relax, have relaxations. Regular relaxations. It's actually a great maybe more of self prevention. Before the thing even starts. But then in terms of what to do when you have your back pain, I think it's safer to talk to your physiotherapist so he or she can plan a self-management system for you. It's just safer. It's just because, like I said, even for us, you don't come and we look at your face and go like, Charlie, I think you should do this and that. We are basing our treatment based on a certain assessment that we've done. So even for us that we are professionals, we are not doing guesswork. We are getting to the bottom of it and giving you a specific treatment. So you that you are home, that you have no idea. You deal with only numbers and images in your office
and
now, Google and stuff like that.
clinic.
Charlie, you may mess something up. So it's just safer. A few people may have done it and it's worked for them, but let's look at the main thing, the main line.
So let's talk about evidence-based researches. Are there any updated research when it comes to the treatment of low back pain? And is there something that we used to do before that we must change now based on evidence?
Yeah. So like I mentioned earlier on, I mean, over the years, so many years ago, we were very fixated on the biomedical approach. Find out what muscle is, what is a problem, the specific thing I talked about. But research has shown that most of the pain that we are seeing are non-specific. So research is gearing towards using the biopsychosocial approach. Where you are not, like I've said, you are not too fixated on, what muscle are we solving, what problem are we solving. There's actually research that suggests that when you tell patients that, it is actually your bone that is broken, or this nerve that is torn, that it unfortunately affects the prognosis. Yes, you're not lying to the patient, but sometimes even the way you communicate to it. I mean, I've heard stories countless times about a certain profession. I'm not going to talk about them, where you go and see them and they do a certain scan and they're going like, is this your scan? Did you work here? Were you in a hotel, or are you sure you work there? And this is so bad. And the patient will like, oh my God,
I'm so afraid.
Yes. And so they're putting fear in you.
Yes.
Then they come and tell them, I can solve it for you.
Oh, God.
So research shows that all of these things really affect your whatever you do. And so we are research is pointing more towards exercise, teaching the patient what they can do for themselves. Our goal is to make the patient independent. So not looking at the number of times the patient can come to my clinic so that I can charge the patient. No, we want to actually make it very independent. Right for the beginners, our goal. So other professions that are asking to pay for 100 sessions, and my patient said he went to a place that you should pay for 200 sessions. I said, why are you asking to pay for 200? He said, if you don't finish it, you can pass it on to your sibling. I said, it's me that I'm the problem. Why are you not talking about? But that just brings me to, I've been talking about the psychology, of back, because it's one of the major things that we don't really talk about. Yeah. So let me talk a bit about chronic pain and psychology. So research suggests that every pain that you have ever experienced is not forgotten, or should I say, it's not. The body has a record of it and memory of it. So let's start from here. The brain can be divided into two, mainly. The other division that we can talk about, mainly to a lay person, the brain can be divided into two areas: the conscious and the subconscious. I get it. The conscious has all the recent things, like what the food you ate last night, what you did last night, or this morning, what you had for breakfast. And everything is there. Or even maybe just last week, everything is there. But if I ask you a question like whether you ever watched Sound of Music when you were growing up, would it be a yes or a no?
No.
What about Coming to America.
Yeah.
You watched the one here?
Yeah.
Okay. I know they've done the second part, but the first was on the
Yeah.
first part.
Exactly.
Okay. So you remember everything, at least Eddie Murphy and the friend going to America and all of that, Semi and all of that, great stuff. So as I've spoken to you about it right now, you are remembering some scenes, and all of that in Come to America. But the fact is that yesterday, you didn't think about coming to America. Even this morning. How come that by just mentioning it right now, you have remembered? I didn't need to bring the movie for you to watch again, but you have remembered. Where was it that it didn't come to your memory yesterday, but this morning or right now it has come? I have just stimulated it. I have just kind of brought it up. So it is like in your subconscious, there are, let's say, wardrobes there where all these files of your past experience have been kept. Anytime something provokes it, it just comes up and it goes to that barrier where it becomes conscious and can remember it. Okay? Yeah. The same applies to pain. Pain that you've ever experienced. You had pain, whatever kind of pain, you did something, medicine, whatever, physio, whatever. The memory of it is kept in the subconscious. And once it's subconscious, you don't feel it again, it's gone. You don't feel it. However, if something happens and it pushes to conscious pain, you will feel it. Yeah. I get it. Now, because of that, God in His wisdom had to make sure that we don't treat pain like the movies Coming to America, where I just said something and Charlie and just came up. No, something has to really cap it because it's pain we're dealing with. So something really caps the memory of pain down there. Now, what is this? These are what we call the feel-good hormones, like oxytocin, like serotonin, and others. There are quite a number of them. They are keeping them there, making sure that everything is sorted. So everything is fine. You're going through life and you're good. Unfortunately, anytime your body goes through any form of psychological trauma, like anxiety, like depression, like extreme fear, extreme anger, in all those psychological stuff that we don't see, the body interprets them as a major challenge. Like it's like attack. We need to deal with this. Something is not right. Some things are going on, but that's not right. So we need to deploy some soldiers to go and deal with this. And interestingly, this same feel-good hormone that are capping the pain are the guys that are recruited to do this job. Yeah. So they leave that job they were doing to go into your body, make sure that everything is fine. So now pain has no cover. So you can just push up. So typically I'm having patients who are coming to me, seeing me several times. When they come, we have checked everything is fine. They said their push-ups are fine. They said they're even doing their exercises, everything is okay. But still, they come, we do our mobilization, we do our stuff, they feel good, they go, the next time they come, pain is like more. Like, what is this? By the time we realize something is not right, maybe some landlord bees, wahala, or some husband wants to do something, or something, there's something eating them up. And research shows that if we can deal with this psychological pain, it makes a big difference. So back to your question, we are not just interested or fixated on a certain hot pack that we are putting on your body or this thing. Yeah, those things may help. But we need to get to the level where we are looking at the patient holistically. What is going on in your life? Can we deal with it? Can you talk to somebody? I have dealt with a patient, for example, who's telling me that my husband wants to take a second wife. And I don't want to allow. But that wasn't the problem. The problem was that she was like, my husband is such a good person. He, on the outside, such a sanctimonious looking mother. Even if I tell my own mother, me the woman, my mother, that my husband wants to do this thing, my mother will say you're a bad woman. You don't like your husband. I get it. So because of that, she's mute. And she won't tell anybody. And she's just there and is eating her up and she's breathing and it's not coming out. Are you getting me? And all she had to do is to talk to somebody to tell her, listen, why do you say they won't listen to you? They're not a small girl. I mean, they're married women with children. Talk to somebody. And that's all we have to do. I get it. The instant that, of course, we have to get a psychologist to come in and stuff like that. But the basic thing that we are making sure that the patient is okay psychologically. And it will surprise you that can take care of all the other things that we do, pulling, doing all this matter, just deal with the psychological pain, and it'll be better.
Okay.
The second thing I want to say about the psychology bit, and I touched on it earlier on, I was talking about how, for example, people will go like, everything was fine when I was working.
Yeah.
You know, when I was active in service, everything was fine, there was no problem. Now that I'm on retirement, you know, everything is coming, I don't understand. So then when I was working, I used to even wake up early in the morning, you know, traffic and stuff like that. That was when nothing was happening. Our understanding of pain has changed over the years. You know, over the years, so many years ago, we used to explain pain as a certain stimulus. You know, I prick you with a pin, and then a certain nerve, afferent nerve, sent that information very swiftly to your brain. Your brain interprets it as pin, remove, and then to send messages through efferent nerves, and then you withdraw. So that was pain, and it made a lot of sense. You know, so pin, and then you take it off. But we have realized that sometimes people can be pricked by a pin, or they will use their thing to, you know, press on the pin, and the blood is coming and they are still there, and they're not moving it. Why? What is happening to this condition of pain? Why is it not working? Because what we are saying, once pain comes, go
To the brain
remove.
and come back.
Why? Because our understanding has gotten better. Yes, a pin will prick you. Yes, afferent nerves will take the message to the brain. But then when it gets to the brain, there's a lot of synthesizing that goes on. There are memories of stuff in your brain. Have you ever been pricked by a pin before? Have you ever heard somebody being pricked by a pin before? Do you remember the last time when you went for women's fellowship? A certain woman said that a pin pricked me and I had tetanus and my hand was swollen.
Yeah.
So as the pin has pricked me, I'm thinking about all of that. That memory has just come. Am I going to die or not? I mean, there are a lot of things, memories and thinking. Where do I find myself? Am I in a meeting with a lot of important people that I cannot shout? I have to keep going. I need to look around. All that information is processed in the brain within that short time, and then the brain will release an appropriate response. Are you getting it? That is why you can have two people pricked by the same pin, same sharpness. One will go like, Ajish! One will go like, hey, stop it. What is that? Stop what you're doing. The same pin. Because one might have grown up in some farmland, be in Shobodam, where Charlie, the kind of, you know, thorns and that have pricked. Charlie, this thing is small. Must I remove it and stop all this play you're playing? The other person grew up in a certain easily gone. Why they don't touch this? So a certain pain, ouch!
My God.
Or, you know, so they can. You can, when you look at these two things, you realize that pain cannot be explained just by the first one. It can be explained by, you know, different people respond to pain in different ways. So that's one thing. The next thing is that sometimes somebody, let me give you an analogy. You are very hungry, you get home, and you realize that, oh, there is jollof, a bowl of jollof on the stove. It's off. It's not on, it's off. The gas stove is off. My wife prepared it. When I was so hungry, when I got there, I just picked it up too. I didn't know it was hot. When I picked it up, I was going around, it was hot. Now I started moving. The first explanation of pain says that once pain comes, I should drop it. Yeah. But then something is telling me that I am hungry, I cannot drop it. So I'm going to manage it and go all the way and put it there. When I finish, I will do this or something like that. There's a function in the brain that can delay things like that. Are you getting me? The brain picks and chooses what it wants to do. It's such a powerful organ, very powerful organ, you know. So I decide what I want to feel. The brain actually decides. Sometimes you're not even, you're surprised at yourself, but the brain decides based on what is going on. Are you getting me? So by the time you are active in service and you have a certain boss who is giving you some stress, and there are deadlines to meet, and there are appointments, meetings to attend, and all of that, the brain is focusing on that. It doesn't mean nothing is happening. things are happening, but suddenly the brain thinks that
It's
this is
not
let's go and
important.
deal with that. So then you do that for all these years. But things are happening, things were breaking up in your body. Unfortunately, you were dependent only on symptoms. I get it. But like I said, the body is powerful, it's tolerant. So because you were hoping that you would feel some pain, then you go for a checkup. The pain, there's something that can, because your brain was focusing on stuff. By the time the music stops and you are 60 years and now there's no sound, everything is, and say go home and go and watch your CNN and enjoy your small. Then reality will come in. Everything that has happened will now begin to show up. And I see people go through all of this. And they get very frustrated. They get very frustrated because they don't understand. I've not fallen down. I've not had an accident. I don't understand about this happened. What is it? Is it my family who doing it? What is it? It's because of all of these things. I get it. So we are saying that all of these things seem very psychological. We don't see it. So back to your question, we as therapists need to be very concerned about the totality of it. What is happening in your life at this time? What is happening, and try and deal with it with you, not, we tell what to do, but it's supposed to be with the patient, we run with the patient, and that really helps the patient to get a good results.
The conversation is becoming very interesting, and I have so many questions that I want to ask, and I'm sure our viewers will also have so many questions that they would ask, but we have to wrap up now. So my final question is on tele-rehab. So, considering the fact that you always strive for your patients to be independent, do stuff on their own, do you think the use of tele rehab is going to be beneficial when it comes to helping people to tackle things by themselves in the right way, in their own convenience?
I think it has a massive role to play. There are countless times that I have I've had calls from my patients who have, let's say, traveled outside to the UK or US, who are saying that, I lifted something in the airport and I had some sharp pain, and because of that, what should I do? I am there, I can't go to any hospital there, I'm just there for fun and stuff like that. And I have had to direct them on phone. I've told them what to do. I've told them, okay, do this, and actually there are people that they have had to commit. Their wife will call me, and it's live camera, and I'm asking their wife to do, can you do this and that? Let me be sure that it's that. Once they do it, and it's okay, now do this and that. So there's a major role that tele-rehab really does, because of course we cannot have everybody coming to the clinic. We cannot have people are living such busy lives. So I think that is a major thing that should be embraced. Like I said, I don't really. We're looking at how to make people better. So distance really shouldn't be a problem. That is not to say that there are not some cases that needs to be. We are physical therapists. So we like to really be physical. There's some things that needs to be done there. But then before, just like we have first aid, before you get there, something can be done. You can manage something. The guy has just traveled for 1 week to Dubai. You are waiting for him to come back. Meanwhile, you can talk and teach him some things to do. And there are so many things that can be done remotely. So tele-rehab is, I think, it's a great thing. It's a good and a better time, and I think should be embraced.
Okay, thank you very much. So just like you said, distance should not be a barrier when it comes to receiving healthcare. So if you have not heard of the Monitor My Rehab platform, it is a tele-rehab platform that has all the therapists and all the help you will need to help you solve all these problems that you are facing without necessarily having to go to a doctor or to see a physiotherapist. There are some things that you can do by yourself that will be taught by licensed physiotherapists and medical practitioners on the Monitor My Rehab platform. So you can check it out on www.monitormyrehab.com, and you have access to very different physiotherapists and medical practitioners that will attend to everything that you need. So Mr. Otu, it has been very, very nice having you here. It has been an interesting episode. I have learned a lot. Great. And I still have so many questions I'm going to ask you after this. And great. I hope you enjoyed our session.
Yes. Thanks for having me. And it's always a pleasure to talk about some of these things, because somebody somewhere is just listening, like, that's my solution. So anytime, I'm
Thank you. Thank you very much. So this episode is proudly sponsored by Starbound. It is your go-to brand for all your pain relief needs. So they have they have a variety of products on the market. They have the warm gel. They also have the cold gel and other products that you can try it as well. So in collaboration with Physiotech, we'd like to present some of our products to our guests so that you can use it, give us a feedback, try it out and let us know what you want. So this is just to say thank you for
Great.
coming.
Thank you so much.
I hope you use it.
Yes. Thank you. Thank you. I'm grateful.
You're welcome.